This is the KRIS 6 News Back to School Town Hall, brought to you with limited commercial interruption by the law offices of Herman & Herman.
Well, good evening, Coastal Bend, and welcome to this KRIS 6 News special. I'm Katia Uriarte. As part of our commitment to you and to help you rebound from this pandemic, we are bringing you this 1-hour show that is dedicated to going back to school. If you're a parent, you want answers. If you're a teacher, an administrator, staff, you want to know, is it safe to go back to school, and what will this school year look like? So let's get started. I want to introduce you to our esteemed panelists. I want to thank everyone for being here this evening. Tonight we have Dr. Roland Hernandez, who has been the superintendent of the Corpus Christi Independent School District since 2014, and just a few weeks ago was named Regional Superintendent of the Year. So congratulations and welcome, Dr. Hernandez.
Thank you.
Thank you. You know him in the community, and he hardly needs much of an introduction because of how much he has accomplished, not only when he was at Moody High School, but now as superintendent of the West Oso Independent School District, Dr. Conrado Garcia. Thank you for being with us, Conrado.
It was my pleasure, Katia. Thank you for inviting me.
And we want to give a Coastal Bend welcome to Dr. Michelle Cavazos, who in June was named superintendent for the Gregory Portland Independent School District. She just moved here from Austin. So from all of us, welcome, Dr. Cavazos.
Thank you so much for this opportunity to join you this evening.
And also on our panel, a man who has completely turned around his district in a short amount of time, a district that is now getting national recognition. Please welcome the superintendent of Fremont ISD, Steve Van Maitre. Welcome, Steve.
Thank you, Katia. It's an honor to be with you.
Thank you. And here to represent her school district, which has an enrollment of more than 3,000 students in the Coastal Bend, please help me give a warm welcome to the Catholic School Superintendent for the Diocese of Corpus Christi, Dr. Rosemary Henry. Welcome, Dr. Henry.
Thank you, Katia. I'm happy to be here with you this evening.
Thank you. And to give us a scientific take on going back to school, and really he's seeing COVID firsthand, is pulmonary and critical care specialist, Dr. Humajun Anjum. Thank you, Dr. Anjum, for being with us tonight.
Thank you, Katia. It's a privilege to be here.
Thank you, Dr. Anjum. So let's just go ahead and get started. So we had a chance to recently talk with Governor Greg Abbott, and we asked him, if in-person school started today, would you recommend we postpone or go forward? And here's what he had to say.
Pediatricians all recommend that the best learning environment for a child is going to be in the classroom. As a result, if and when possible, we want to ensure students will be able to learn in a classroom. Whenever and wherever possible, we encourage schools to be open physically for classrooms for students, as many as can attend, to attend, while also maintaining the flexibility for this distance learning. Bottom line is this, and that is local school districts have the decision-making ability to decide when the school year will begin, and when that school year begins, whether they want that school year to begin online or in classrooms, and if it begins online, when and how to bring students back into the classroom.
So as we heard the governor say, he's really putting it in your hands, the hands of the school districts, to decide when and how to reopen. So Dr. Hernandez, you have the largest school district in the area. Can you elaborate on what is your plan for CCISD?
So right now our plan is to open up September 8th. That'll be right after Labor Day. We'll start with providing face-to-face instruction for all the students who choose to come back to our schools. We'll be having all of our teachers teach from the classrooms, whether they're teaching the students face-to-face or providing the remote learning for the students who stay home. And so the options, of course, are face-to-face or to learn remotely from home. Parents know we put our reopening plan out recently that we're asking them to commit to whatever approach they choose through a whole grading period before they decide whether they want to change or not. But that's where we are right now, starting class on September 8th.
And that is face-to-face?
Yes. Otherwise, we'll start August 13th for all students to be learning remotely.
Gotcha. Okay. Dr. Cavazos, can you tell us what your plan is for Gregory Portland, which also you're going to start virtually, correct?
Correct. Very similar to what CCISD is doing. Our first day of school is the 13th, And for the first 3 weeks of school, all of our students will be participating remotely. And then beginning September 8th, we will begin a phase-in process of welcoming students who've chosen our face-to-face option back into our facilities.
Is the plan for the first couple of weeks, that's what is established now? We can't really make a plan for the rest of the school year. Can there be a plan in place until, let's say, December, or for the entire school year to go one way or another?
Well, so if I interpret your question accurately, we're giving our families the option to do the online 100%. And like CCISD, we prefer that they go by the grading period it just makes it a little easier. And then our hope is that for all those families who have chosen face-to-face, that we'll be able to continue through the semester. We do have a facility response plan should, in the event that someone contracts a virus in a facility, and we'll handle those on a case-by-case basis.
Dr. Conrado Garcia, as of right now, you're moving forward, right, with online learning until October.
In the month of June that we traditionally do summer school, we decided to do summer training for teachers and to prepare them even more so for the virtual world. And our teachers did a tremendous job in the spring for not being exposed to that previously. And second, what we did is move our summer school program to the middle of July. And that was intentional, so we can get an experience factor with over 300 kids and literally work on our virtual learning environment. Our surveys indicated that parents wanted virtual learning, and they wanted it for an extended period of time. And the board wanted for us to continue under the recommendation we made through the 16th of October. In the meantime, we will also plan for that with the smaller classes and offering the virtual learning as well. And if we go back to the school, we will modify some of our operations, obviously, to keep a safe distance and the mask and feeding kids in the classroom, etc. So we will do that like all my other colleagues will.
Dr. Henry, Attorney General Ken Paxton said that religious private schools are not restricted by local public health orders. So what is the diocese plan for going back to school?
The safety, health, and well-being of all of our students and teachers and staff are just critical, and we value those immensely. Officially, our first day of class is Wednesday, October 5th. And this is a remote learning opportunity for all students, grades pre-K3 to grade 12. Now, following all safety precautions, our plan is very specific in welcoming all of our students back in person on September 8th with a number of options, a number of platforms. One, of course, will be in-person classroom. One, of course, will be online learning option. And then we also have, for our middle schools and high school students, we will have a rotating option of a Monday, Tuesday, Thursday, Friday, with the variable of online learning. This is going to be a challenging year for all of us, but we think it's going to open a lot of doors in the area of teaching and learning, some new ideas, some new opportunities where students can learn, where students can lead, where students can serve, and where students can succeed.
Let me ask this for Dr. Roland Hernandez as well as Dr. Cavazos. When we were talking earlier about West OSO and the fact that they have extended already into October their distance learning, how do you determine everybody is kind of starting differently or keeping that virtual learning for an extended period of time?
Well, for us in Gregory Portland, we had done a survey in June of our community to just get an idea of what our families were wanting. And at that time, it was about 60-ish% who wanted face-to-face. So as we developed our plan for the fall, that's what we used. And as cases have spiked through the summer, that's gone down to about 50%. And so we know we have a large portion of our community who really does want to get back to face-to-face. And so for us, we will be phasing in beginning September 8th, starting at about a 25% of those who've chosen the face-to-face option to be in our buildings for 2 weeks, and then phase in the next group to a 50% and so on.
Gotcha. Dr. Hernandez?
In our case, similar, we, at the time we made our decision was to delay it through September 8th, Labor Day. And that was mainly because we started to see the numbers start to spike and the spread. So it just gave us some time to reassess, and then we'll come back at that time and decide if we need to move it back further. But, you know, we did adopt a year-round calendar this year, and we built in intermittent weeks throughout the year. So if we have to make adjustments like that, we can. That's our plan right now, all remote learning through the 8th, and then start the face-to-face. And then we'll just kind of gauge it at that time to see what our situation is, since it's so different across the state.
Right. Stephen Maitre, I'm going to get to you this real quick before we go to break, but the Fremont School District, you guys actually held in-person learning for the first 3 weeks of June to end your year for last year. You were on national TV talking about that. You know, the Texas Tribune is actually doing a story on you. Tell us about the successes and the challenges that you faced with in-person learning in June.
Well, Katia, we did, and we were so excited to see our kids. Fremont opened its doors for in-person instruction on June 1st, which was the first day that Governor Abbott allowed schools to do that. Now, at that time, the Fremont community had 0 cases of positive testing. Our teachers were heavily involved in collaboration with our plans, and we spent a lot of time on making attention to detail. Some of our successes were that we're very proud that nobody got sick. None of our students, none of our staff became ill. And we did make some significant improvement in closing that COVID-19 achievement gap that we saw from when we literally had to pivot from one day to the next from your traditional in-person model to a remote virtual. And we had a significant decline in student performance from that crisis mode of instructional continuity. And we also, one of the challenges is we have to be much more prescriptive with our instructional delivery in every one of our classrooms, because time is precious, and we have to be flexible enough to where if there is a spike in community spread, we can transition from in-person to remote from one day to the next, like we did in the spring.
What we're going to do right now is we're going to take a quick break, and when we come back, the first question is going to be to Dr. Anjoum, and the question is it safe for our kids and our teachers, as well as our administrators and staff, to go back to school and learn in a classroom setting for our kids? That answer after this short break.
The Back to School Town Hall is a presentation of KRIS 6 News and has been brought to you by the law offices of Herman & Herman. You're watching the KRIS 6 News Back to School Town Hall, brought to you with limited commercial interruption by the law offices of Herman & Herman.
Welcome back, everyone. You know, we had dozens of questions like this one from David Meddy.
How are we going to ensure the safety of our children, you know, reassembling together and moving forward? So in order to reestablish that effective learning environment that we all count on.
Dr. Anjoum, as a pulmonary specialist, you have seen COVID and its effects firsthand. In fact, you're at the hospital right now. So the question to you as our medical expert, is it safe for our kids to go back to school in person?
I think that I'm not going to do the whole debate whether it's, important to open up and reopen schools. I think that's already established that this is something that as a nation, we need to move in that direction. But from a, clinical standpoint of view, we know that children less than 18 years of age, they usually experience very mild or sometimes no symptoms at all in terms of COVID-19. And as compared to their adults, they are much less likely to face any severe consequences from this infection. And I think we have a very good plan, as far as I have heard from everybody, in terms of reopening and always trying to see and reassess the situation and see if we need to fall back to remote learning again as compared to face-to-face learning. To cut the long story short, I think in terms of the infection rates, we do not see any significant problems with children getting affected by it and being very sick. But again, the risk of community transmission is something that looms at large.
But the risk is there. And that leads me to my next question. The big concern being teachers, staff, adults, like you were saying, Dr. Anjum. James Davis writes in, I'm a teacher. I have many, many friends that are older and all have some sort of medical issues. What's going to happen if they get sick? How are schools going to handle that? Also, Raul Garza asks, a lot of our teachers are in their 40s, 50s, 60s age range. What will be done to protect them as well as the students? And Charlie Flores says, what will school districts do when a teacher gets infected? I will open it up to the panel. Whoever wants to start first.
Well,
Let me, if I could address that, because I think it may be a little easier in Fremont to address that than it is in Corpus Christi. We're limiting our in-person to 11 to 1. That will raise the odds in our favor of everyone practicing social distancing. We also have a very, very comprehensive response, recovery, and redesign plan that is very specific regarding if a teacher or staff member starts exhibiting symptoms, what happens next. And if they are quarantined, then we're going to protect those people. They're not going to be using any of their benefits while they're away from school. And then if we have a student that's at school and starts exhibiting high temperature, whatever the symptoms are, sore throat, we have an isolation area at each of our campuses until the parents can come and pick the student up.
Well, I wanted to say our teachers are very apprehensive, and rightfully so. This is a scary environment that we're in. And so if we don't practice what the CDC, what common sense tells us, that using a face mask, the social distancing, good hygiene of washing our hands on a regular basis, and not take any of that lightly, then I think we're going to be doing just fine when we open school with smaller environments. Let's be clear, smaller environments. But it's not only just to take care of our teachers, but all of the employees that are on that campus.
Dr. Cavazos, your school board just approved a 3% pay raise for your teachers, which is an amazing gesture, especially at this time. What is your district's plan when a teacher gets sick, infected? How do you deal with that?
I think many districts are using this a process map that outlines each situation that might occur. If there's symptoms but not positive, they're positive but no symptoms, etc. And so we have a step-by-step process for us to follow for each staff member. We also have a facilities response protocol that goes from level 1 to level 5 that helps us determine the amount, if we close a classroom, if we close a school, based on cases that are confirmed within the facility. So, we've, like the others, our employees are of utmost importance to us. And, our auxiliary staff have been working the entire time. Since March 13th. They have been going in and cleaning and getting things ready this entire time and throughout the summer. And so, we are here to support them. But if the fear is very real for the adults, especially in this situation.
And Dr. Hernandez, what does that look like for CCISD? And also, will there be some way where if a teacher gets sick, they don't have to use their PTO? How does that look like?
We have a similar process. We have a flow chart that kind of guides our schools on what to do if those different scenarios happen. Of course, as mentioned by everyone, the safety is the most important for our teachers, our students, and all of our staff in the schools, and transportation, you named all of them. Regardless of what the case is, treating them all with urgency and making sure that we're following up with questioning who was in contact with that individual, are sanitizing immediately like we would be doing, but then it would be an extra deep cleaning in that particular classroom or that particular area of the school, and then just making sure that we're adhering to all the health guidelines in place.
And that leads me right into the next question from our viewer, Joe Vasquez, who says, what happens when anyone in the classroom becomes positive? What's the protocol then?
I think immediately for all of us, it would be removal of the employee and then immediate questioning as to where they were in the school other than their classroom, who all they came into contact with, and then contacting those individuals as well and providing some questioning and going through the procedures that are in place, and then requiring that they quarantine or stay home for a number of days, as well as during the time that they're under the care of a physician. And then as far as closure, it would be closure of the class itself, maybe a particular area of the school. And I'm using examples from the full range of a Veterans Memorial with 2,000 plus students in one school, and then another campus that might have 300 to 400 students in a school. And that's where you're just going to have to assess, is it something we can do by containing and closing down one wing of classrooms, or does it require closing the entire school?
Will there be notices sent out if somebody tests positive? Will they be very clear in what happened, or will it be very vague because of HIPAA? We had one of our viewers ask that question.
Well, and so we're all in the same boat with that. To the extent possible, we're going to be very transparent and provide as much as we possibly can with nothing to hide, and letting our parents know exactly where we stand. We've also been doing that as a district over the summer. You know, many employees of the district who've tested positive, those are employees that aren't even at the district. But just sharing that information, keeping people informed, is what we would do during the school year as well.
You know, depending on the exposure, and just like Roland said, that how much of the building does it affect. But Annette Rodriguez, the health director of the city of Corpus Christi, let me tell you, she's phenomenal. And she's a wonderful resource. And West also has reached out to her on a number of things related to the virus, and some do's and don'ts and suggestions. And I share that because that's great news to know in our community how well versed she is, and is wanting to assist school districts in any way possible.
Yeah, I want to echo Conrado's point there. The last thing I think any of us want to do is turn into public health officials and make those type of calls that people with greater expertise, such as us, such as our doctor that we have here, and the people in Alice who give us great information. We have got to rely on their expertise to make these tough decisions for each of our schools.
Dr. Anjum, after hearing what the superintendents have to say, anything that you want to say about their plans, especially if somebody's infected?
No, I think, I mean, it's a very promising to hear everybody speak about their plans, and very reassuring, I think, the way things have been outlined and all the plans are in place. I just sometimes feel a little sad and feel that it's tragic that we're having this conversation in United States, where we have multiple instances and examples of various countries across the world who have opened schools and they have not had any problems, just because I think, their social distancing practices, hygienic practices, all those things were so good that as soon as this virus hit them, and with all the social distancing and taking all the necessary precautions during the summer months, they were able to open schools during the fall. And I just hope that people realize that these are the things that they need to keep practicing, and hopefully we don't run into any big issues later on.
And speaking of hygiene and social distancing, we are going to talk about that. How do you enforce that in your schools when it's time to go, into the classroom, into the buildings, into the schools themselves? So we're going to take a quick break and be right back.
The Back to School Town Hall is a presentation of KRIS 6 News and has been brought to you by the law offices of Herman & Herman. You're watching the KRIS 6 News Back to School Town Hall, brought to you with limited commercial interruption by the law offices of Herman & Herman.
Welcome back, everyone. We all remember what it's like to walk the hallways in school, right? I know it's been a while for me, for our area superintendents who have been educators, and you're there all the time. You know what it's like to be in the hallways. You're talking and you're touching each other. What is it going to look like when it's time to social distance students? How do you do that?
It's different, Katia. If I could jump in, since we've done it. But let me tell you what really worked for us at the elementary level, and it's something that we've all played with many years ago. Hula hoops. Everyone,
I heard you had hula hoops. Yes.
Hula hoop. It can be as simple as a hula hoop, and they love it. Every one of our pre-K-5 elementary kids is given a hula hoop, and when they're in a common area, they have their hula hoop. And it got to, I thought they were going to fight with the hula hoops, but it got to the point where they didn't even want to touch their hula hoops with another hula hoop. So that's just a simple, fun strategy that we've incorporated in Fremont, as well as all of the other things that we've done, the temperature checks, the face masks, the shields, we have the desks with the shields on it. But there's nothing more effective than a good old-fashioned hula hoop.
How did that work for the middle schoolers and the high schoolers? That's the question. Do they?
I don't think it will, but they've asked if they can have it.
Okay.
Well, and I appreciate what Steve says, because, as the adults, we've got to inspire our kids, and, yeah, this is a scary virus and we have to take it seriously, but these are kids and they're very resilient, and it is up to us to inspire that hope and that excitement in them. You said about going down the hall and patting on the back. Well, it's gonna be more elbow bumps, and getting to say hello to each other, again, with all of the other safety precautions, but it just looks different. But it doesn't mean that it has to be scary and that you're all alone. There's still that verbal interaction and eye contact, and so much that can be communicated that way.
You're right. Instead of a fist bump, you do like the elbow bump, and it's just teaching the kids, right? Yeah, this. And it's something that they could get used to, the new normal, right? Gracie, I want to ask really what we're talking about. How will enforcement occur between classes during PE, before and after school? Leah Mackey is asking, are the kids going to have to wear masks? Is that going to be mandatory?
Well, at West Social, that's the position we're taking. Once we come back, that face mask, all of the other recommendations that we continue, that what adults are doing with the social distancing and washing hands and smaller classes, etc. But that also will continue with how we view athletics and the things that we do in that environment, what we do with band and what we do with choir and so on. And to use other spaces at times within your schedule, such as gyms, when they're not in use, or cafeteria that's a big space, or libraries, which is a big space, that you can do more of downsizing those particular programs. Like for example, we started football practice and volleyball, etc. If you look at our football plan that we submitted to our board, and you'll notice that we have face shields and questionnaires and temperature checks, and I mean, and nobody's assigned a locker, or no, they have to have their own water bottle, and I can go on and on and
Yeah,
on.
you're getting ahead of me on that one, Conrado, because I'm going to ask you about extracurricular activities, knowing that West Oso, along with other school districts, started UIL practice on Monday. So I want to talk about that specifically coming up in just a little bit. But in the meantime, a show of hands, are face masks required in every school district?
I just wanted to share something to go back on that. Yes, we're requiring face masks, but on the social distancing, you know, a big goal of ours is just to limit the amount of people in any one particular place. So we'll have staggered times. We won't be letting the kids transition all at the same time between classes, into cafeterias, things like that. We'll have all the appropriate signage where it needs to be, where some hallways might have been both directions at one time, could become one-way hallways. So it'll be very limited access to where everybody's together at the same time. And then we would be practicing that social distance. It's going to take a whole team effort to make sure it happens.
It is. It's going to take everybody to make sure that it's enforced, and really, like Dr. Cavazos was saying, just teaching the kids something new, right? And not making it scary. But hey, guys, this is the new normal for now. Dalia Carranza has asked, are kids going to be tested before going back to school? And Mario Salinas adds to that, saying, will they be tested before going back to face-to-face? And if so, how often?
As far as COVID-19 testing for positivity, is that the question, Katia?
Yes, Steve. So will kids be tested for COVID-19 before going to school? Yes.
That's what I want. That's what I want the federal government and to pass through to the state government. Think about this. If we could have daily, unintrusive testing of every one of our kids, teachers, whoever would come into our building, if we could get point of care testing with immediate results, then we could go back to almost the way it was in March. But until that, then it's going to be very difficult.
Well, that capacity does not exist right now.
But I think it could, Conrado. I think we as a nation have the capability to do that.
Absolutely, and I'm with you on that thought process, but I'm just being candid that I wish it did exist, believe me. That would solve a lot of our issues, because, you know, we don't have an MD next to our name. And so we rely on the honesty of people, whether adults, or we're going to rely on the honesty of the students as to where they've been. Have they been exposed? Have they, as somebody in the family, do they have fever? Have they been throwing up? Have they stopped eating? And I can go on and on and on. We all know that. But that's up to those individuals to tell you the truth.
Sorry, I was just going to add, in lieu of that, I think those are good points, and that's a good question too. That's been the biggest problem, I think, that we've had, not only, you know, in context with children, but overall in terms of testing, that we haven't tested enough people, and we're always struggling to test enough people, and especially children who are mostly asymptomatic or have mild disease. They can still transmit the virus. We don't have enough data, but it is known that they can still transmit the virus. So even if people are not having any symptoms or anything for that matter, they can still transmit the virus to other people. So, you know, when you think about it, contact tracing and surveillance would have been extremely beneficial and have, you know, a lot of help.
Let me ask our panel, when you actually go back face to face, we say we're wearing masks, we're doing the social distancing. Is it checking for fever every student? And I'm asking this because I really don't know the answer to this. What will that first day back look like?
For us in Gregory Portland, we won't be able to take everybody's temperature. It's like Conrado indicated, we are relying on people with that. Yes, I'm being honest. We do have a screening and tracing form of questions that we will be asking students each day. And we will have families, if students are being riding the bus, before they're allowed on the bus, they will be with a parent or guardian and go through the screening questions. But again, it does rely on honesty, and people are in different places with what, they need to, they're trying to balance childcare, but safety and, trying to balance all of that for the families.
Okay. When we come back, we are going to talk about extracurricular activities. A lot of schools this week, including Toloso Midway and West Oso, started sports practice. So we are going to talk about that right after this quick break.
The Back to School Town Hall is a presentation of KRIS 6 News and has been brought to you by the law offices of Herman & Herman. This is the KRIS 6 News Back to School Town Hall, brought to you with limited commercial interruption by the law offices of Herman & Herman.
Welcome back, everybody. So we're talking extracurricular activities right now, football, band, anything that goes in that direction. Toloso Midway, Calallen, West Oso, you all started sports practice this week. And Dr. Conrado Garcia, you had your coaches submit to you, as you were saying earlier, a very detailed plan on how they were going to keep kids safe during practice. What does that plan look like overall?
But here's the deal, that we wanted, obviously, to get our kids out there. They're ready, and we're ready for them. And so our coaching staff developed a comprehensive plan that included, for example, the football team, that our trainer, our athletic director, and coaches not only take temperature of the players, have a daily questionnaire, what they would do. They would put those face shields that go in the past was more for styling, but now who would have known it's really a good protector from the virus. Face mask as well. They have to have their own water bottle. No lockers will be assigned. No congregating in locker rooms. These things would have to be done outside in the field. But here's another very important factor. It's a parent choice. If they do not want to participate yet because they don't feel safe, they don't feel comfortable about the environment, they'll be held harmless. When they are ready to participate and so on, we will welcome them back into the team with no penalties whatsoever.
And I was many years a high school coach. Yes. There's no better, more effective at-risk program in any school than your athletic, band, extracurricular programs. But having said that, we were initially going to start school on August 3rd. And the UIL has given us, because of our classification, an opportunity to come back and start practice on August 3rd. But we moved our start of school back to the more traditional fourth Monday in August 24th. And I just didn't think it was in the best interest of our community and our kids, which is different than other communities. I just didn't feel comfortable saying, okay, it's not safe to have in-person instruction in school, but it's okay to practice football and volleyball and cross country. So we're moving it back in proportion to when we're starting school. And I know that's very disappointing to our student athletes and our band members and many of our parents, but it's something that I had to do.
Thank you for sharing that with us, Steve, for sure.
I'd like to
I'll
offer
open it up to the rest of our panelists. Yes, please. Dr. Henry.
athletics and co-curriculars is a very essential part of the education of our young men and women in our schools. And these are very difficult decisions during a very difficult time. In our Catholic schools, we're actually beginning strength and conditioning on August 10th, but only for phase 1. We're not making any more plans at this point in time until we study the data, the statistics. We receive information from our local health authorities, the various physicians we work with, the various organizations and agencies that we look to for advice and recommendations. And so we, as someone mentioned earlier, we really want to have them engage with one another, but in a very safe way, with the wearing of the mask, with social distancing out on the field during strengthening conditioning, 8 to 10 feet apart, small groups of 10 or less, small cohort groups. And as we wait and as we see and we have more time to study and analyze, we'll determine what phase 2 will look like. And this is just not for football, but we're looking at band, we're looking at certainly drill team and cheerleading and spirit and all of those kinds of things. It's a lot of people that we're impacting with decisions about athletics and co-curricular.
Well, we have a different situation for our district. We have one 4A high school, which is Miller, and they have started their practicing. We did have all of our high schools do the strength and conditioning with no incident. A lot of times over the summer, many of our athletes play for travel teams and select teams. And I think our coaches have done an outstanding job that because of the risk that those individuals could present to the rest of the players, the coaches themselves asked if anyone was going to be traveling out of the city to go play in these various tournaments through select ball and summer ball, that they would be better served to not attend the strength and conditioning program and to continue to travel with their team. The difference that we're seeing here in making that decision is that with these programs, whether it's football, volleyball, whatever the sport, band, is that you can stagger the times out to keep your numbers low. And then you can also make sure that they're socially distanced during those staggered times with low numbers.
I'm going to get Dr. Anjum to jump in real quick. Just give me your take on sports and kids and COVID.
The challenging part, I think, with the virus is it's so fluid that we don't even know how things are going and how it will be by next month. So I think the plan that everybody has outlined, depending on their own districts, seems pretty reasonable to me. Respecting the fact that children need to get outdoors, and athletic performance and contact sports, for that matter, are part of, I think, their learning process as such. But at the same time, taking all the necessary precautions that we can. And once again, as somebody mentioned before, we can never be 100% sure, but all we can do is probably try and take all these precautions. So the rate of transmission between children by themselves is not very high at this time, as the data suggests.
And we have so many kids, though, in our districts that will, that live with grandma and grandpa. And I think we touched up on this real briefly, but that is a concern.
That obviously, I think, still remains a concern and will remain a concern. And I think especially for families where they know that they have people at home who meet these high risk conditions, more than 55 or 60 years of age, with other underlying illnesses, will be the high risk population. So I think by itself, I think society and people need to realize that they need to take their own precautions too at the same time.
I think that's really well said. The school districts can't do it alone. The teachers can't do it alone. We need our community, we need our parents to also practice what we're preaching in order to keep our community safe.
Absolutely.
Melissa Solis, whose child attends Woodlawn Elementary, asked the following. She says, what happens if parents don't have devices, laptops, computers, even tablets or phones for the kids that can't do the e-schoolwork? Jessica Reina, whose 4 kids attend West Oso and will be doing so virtually, asked the following. She says, the only concern I do have is that we have only one device. I have several kids in school. How are they going to do their work all at one time? So basically, what do parents do if they don't have laptops and they have multiple kids at home?
Is to provide loan equipment, Chromebooks, webcams, hotspots for students and families to take home, should they need that equipment, those devices, to help them with remote learning. We have a loan procedure and process that worked very well for us during the 9 weeks that we were shuttered.
Is there some money also that's been allocated by the government to do this? Roland, I'll throw that to you since you have the largest school district.
Recently, they've allowed school districts to apply through Operation Connectivity if they're needing some extra devices for their district in remote learning. I'm very happy to share that our school board recently approved close to $4 million worth of technology devices to try to make sure that we were reaching all of our students who are going to choose the remote learning. There is 2 types of remote learning, and that's synchronous learning, which is where students are going to be interacting face-to-face with their teacher over the computer. But then there's also asynchronous, and that would be a good example of where an asynchronous situation might come about, where you can't have multiple kids with only one device receiving instruction at the same time. So in CCISD, when our teachers are providing their instruction to their classes, all of it's being recorded. And so if a family has to run into that situation, the lessons that our teachers are providing throughout the day to students, they will be able to go and pull up that lesson so that that student can do the same exact assignment or receive the instruction at a different time that the class actually did.
However, access does not always translate into equity. And putting a device and connectivity into a home is not always good enough. And we as public school districts have a responsibility to not only put that device and connectivity into that family's home, but we also must provide the high quality instructional continuity that goes with those devices, because we have single parents with multiple children that have low technology skills, and our expectations are going to be very high for those kids with respect to teaching and learning. So that's the part of the puzzle that we have to improve at here in Fremont.
Well, yeah, I want to, I appreciate what you say, Steve, about, it is on our teachers to provide that high quality delivery. Another piece that we've built in are monthly lessons or learnings, and then taped lessons on, or not lessons, but how parents can support their children through this to hopefully answer some of their questions as they help their students and facilitate their learning environment at home. We're very fortunate that we were able to purchase a device for every student in our district, as well as provide hotspots for every family who needs one. And we are expecting everyone to use our district issued device because we can better support it with if there's any tech support needed, as well as it comes loaded with all the programs and software that our students will need in their homes.
All right, well, this 1 hour, it went by pretty fast. And our hope, of course, is that as a parent, you had a lot of questions and they were answered. And as we leave you now, I do want to turn to all of our superintendents and just ask them to talk to our parents out there, our teachers. Give us a final pitch on why you believe your schools are ready to educate safely during the pandemic.
I am confident that the education that we can provide is going to be of high quality, whether they choose face-to-face or remote learning. We have worked really hard over the entire summer to get ready to this point. We can assure parents too that they may be thinking that remote learning in school is going to be like it was in the spring, and that is not the case. At that time, schools were more about in a survival mode, but providing top quality instruction from our teachers, who I know have worked hard. They're going to be reaching out to their students every day, and we want to take the best care as possible of our teachers, our employees, and our students.
And every community is different. In our community, in the Fremont community, at this time, it's safe to come back to school. However, that may change next week. Our schools provide so many services to our students. High quality education, nutritious meals, health care, speech and vision. It's really, really important that we get our students back in our schools when it's safe as possible. And in Fremont, we have experience in doing it the safe, right way. Thank you for the opportunity.
So as I speak to parents, I want them to know that their children are a true blessing to us. We love them like they are our own children. Our teachers are dedicated to the safety and the well-being of every child entrusted to our care. We are committed to robust academic instruction, whether it be remote learning, distance learning, the hybrid model, person to person. All summer long, our teachers have been engaged in professional development opportunities, workshops, and seminars that strengthen their ability and capacities and skill sets to deliver online instruction, to improve on what they've done in the past, in the spring of the year, and also some new initiatives and rollouts for our schools. Our schools provide very safe, nurturing, loving environments where students grow in faith, knowledge, and service.
We have a golden opportunity here, and the opportunity is that we know it's a very personal decision from families. And I can assure them that the superintendents of this wonderful city and outlying areas such as Fremont and our Catholic schools, we're listening. We hear you. We hear that you want wonderful instruction, but we also hear you want a safe environment. And I can tell you, we are doing everything humanly possible to join the two. So we'll see you, West Oso ISD.
Go Bears!
Virtually on August 24th. And again, thank you for this wonderful opportunity.
Thank you, Conrado. And of course, Dr. Cavazos, our newest superintendent to the area.
To our Wildcat Nation, students and staff and families, we are known for academic excellence, and that will continue whether you choose a virtual option or a face-to-face option. And we've enhanced our virtual learning experience from the spring. We are thrilled and super excited to see you on August 13th virtually, and then in face as we phase in beginning September 8th. And what we want you to know, families, is that we want the same things for our kids. We want them happy, healthy, safe, and learning. And we ask that you focus on extending grace, on focusing on being unified as a community, and looking at what our kids are gaining through this experience. They're learning how to be resilient. They're learning how to adapt to change and how to unite for a common goal. And we thank you for the opportunity to serve your students and look forward to seeing them back.
Go Wildcats as well. Thank you so much for that, Dr. Cavazos. And last but certainly not least, our wonderful doctor who has joined us today, who has taken the time to join us today, Dr. Anju.
I think, returning to school is so important for the healthy development of, of children and for their well-being. Just to pursue this process of reopening of schools in a way that is safe for all the students, teachers, as well as the staff, I think is very important. Part of it is science, and some part of it is obviously, something that science cannot explain. But I think when you're faced with a decision of such gravity, it is very essential that all the experts whether those are public health officials, physicians, and then, in consultation with the educators and members of our affected communities and institutions, work together and develop a safe environment. So I feel very comfortable today after hearing, everybody's plan, and looking into things the way, it has been described by all the superintendents, and I feel a lot safer.
And we appreciate all of our panelists. Thank you so much for taking the time to join us and to talk about what's on everybody's minds. And that's going back to school, again, the safety of our kids, our educators, our administrators, our staff, really our community as a whole. So I thank you. And I want to let our viewers know that the conversation does not end here. Coastal Living, which airs on our sister station, KZTV, will be hosting Education Week next week. Also speaking with some of our panelists who are here today in more detail. That's going to start Monday of next week at 9 in the morning, again on KZTV. Plus, there will be a drive-through back-to-school fair that we want to let you know about that's happening this Saturday. It's hosted by a group that's called Lead First. It's going to be outside the Ray High School gym from 10 in the morning until 2 p.m. Immunizations will be offered for free for eligible students. Backpacks would also be given away. And the Coastal Bend Food Bank is going to be there handing out milk and fresh produce. Everything is free, and again, happening this Saturday. So on behalf of our superintendents and Dr. Anjum and all of us here at KRIS 6 News, thank you for watching, and good night.
The Back to School Town Hall is a presentation of KRIS 6 News and has been brought to you by the law offices of Herman & Herman.